So good morning again, everyone. This is the January 2023 in-service on cholesterol, and I'm going to turn it over to Ashley, who's going to talk to us all about it. It's all you, my friend.
All right, so cholesterol, what exactly is it? It's a waxy substance that can be found in your blood. You need it in your body to actually help you build healthy cells. However, if your levels get too high, it kind of lead to those fatty deposits in your blood vessels. And that is when it gets dangerous because it can increase your risk of heart disease, peripheral artery disease, and can even lead to strokes. So as we see in this diagram here, this is what it should normally be, is the one on top. And then over time, as your cholesterol levels increase, these fatty deposits kind of build up on the inside of your arteries, and eventually they could block your artery completely. So cholesterol is carried through blood on lipoproteins. Some of the three main ones is your high density lipoprotein, or HDL. It's usually referred to as your good cholesterol because it absorbs all the cholesterol found in blood and carries it back to the liver where it can be flushed from the body. Higher levels of HDL can actually help decrease the risk for heart disease and strokes. And right now it's recommended that HDL levels should be above 60 milligrams per deciliter. Then you have your LDL, which is usually referred to as bad cholesterol, and it carries cholesterol to the cells in your body and contributes to that plaque buildup. The higher levels of LDL can increase your risk for heart disease and strokes, so you want that level to be below 100 milligrams per deciliter. And then there's also a very low density lipoprotein, which carries triglycerides through the bloodstream to body tissues, and it can also contribute to that cholesterol buildup. The higher levels of VLDL, those can also increase your risk for heart disease and stroke. So we want those levels to be below 30 milligrams per deciliter. Once your cholesterol levels get above 200 milligrams per deciliter, it's what is known as hyperlipidemia. It's what your doctor will probably tell you have. So you want to get cholesterol levels checked regularly by your doctor, just because high levels of cholesterol don't necessarily have symptoms associated with it. That's why it's important to get them tested every time you go to the doctor. So what are some of the causes of high cholesterol? There's many different factors that can contribute to it. Genetics is one thing, but also the most common is the unhealthy diet and the inactive lifestyle. Smoking can also contribute, obesity, and also drinking alcohol can contribute. So on the right are kind of your foods that you want to stay away from to help decrease your cholesterol. So your things like butter, fried foods, too much red meat, even egg yolks, and dairy products. Some of the ways you can kind of impact your cholesterol levels. So diet is one of the main things. Different foods can help control these high levels of cholesterol. We already talked about the ones you want to kind of stay away from. Saturated fats should be limited and trans fats should be avoided. These types of fats, they stay solid and are more likely to clog those arteries. Saturated fats, they're found in most animal products and some plant foods. And then these trans fats are kind of man-made saturated fats, and they're what you find in many of your snacks and your foods like margarine. So eating more unsaturated fats can improve your cholesterol levels. Those are the ones you want to kind of eat more of. These fats tend to stay liquid and are less likely to clog your arteries. They're found in vegetables, tree nuts, and grains. And there's even a diet that you can kind of follow. So if you do have high cholesterol or your cholesterol is a little bit elevated, there's the Mediterranean diet that a lot of people can use. The main parts of the diet is just to substitute certain cooking oils like your vegetable canola oil and using something better like olive oil. You want to try to eat less red meat, poultry products, and dairy products. And you want to try to intake more fish, vegetables, nuts, whole grains, drink alcohol in moderation. So I included the little Mediterranean diet pyramid. So for your red meats and your sweets, you can still have them. It's just you have to have them sparingly. Your poultry, your eggs, and your dairy, so your milk, cheese, chicken, you can enjoy that 1 to 2 times per week. Your fish, seafood, and omega-3 rich foods, some of your nuts have those too. You can enjoy them more than 3 times per week. And then the bulk of your daily diet should be those whole grains, fruits, vegetables, the healthy fats like the olive oil, and then different herbs and spices. Exercise is also another thing. So it can help increase your HDL levels, but also helps you stay active. And it's recommended that you get at least 30 minutes of moderate intensity exercise 5 days a week. So that's just breathing heavy exercise. And then you could also choose to do 20 minutes of a vigorous aerobic activity 3 times a week if you didn't want to do the moderate intensity exercise. For the medications to treat high cholesterol, so the mainstay treatment that most people get put on is your statins. So that could be your atorvastatin, simvastatin, pravastatin. They have the rosuvastatin and lovastatin. The way they work is they competitively block the active site of the HMG-CoA reductase, which is the rate-limiting enzyme in the pathway that cholesterol is made in your body. And they decrease your LDL and triglycerides and slightly increase your HDL. Some of the side effects form, so it's your myalgia, which is your muscle pain. It's what you're going to mostly hear about. There's the nausea, diarrhea, and stomach pain. You can even have some stomach cramps, the elevation of liver enzymes, and in more rare cases, you'd have this rhabdomyolysis. And then we have the cholesterol absorption inhibitors. These are usually added onto your statin. So the main one is the ezetimibe or Zetia. It inhibits the absorption of dietary and biliary cholesterol. It decreases your LDL, slightly decreases triglycerides, and slightly increases HDL. Some of the side effects associated with this is the stomach pain, diarrhea, and muscle soreness. And then we have some injectable medications that could also be used. And these are your PCSK9 inhibitors. So you have your Praluent and your Repatha. These are usually reserved for patients that can't tolerate statins or other cholesterol medications. The way they work is they indirectly regulate LDL levels by reducing the number of LDL receptors on cell surfaces. They decrease your LDL levels, and the common side effects with them is injection site pain, itching, and swelling. And again, these are used for patients that can't tolerate statins or those other cholesterol medications that we have available. There's also your bile acid sequestrant. So that's your cholestyramine, your Welchol, and your Cholestit. The way these work, they remove cholesterol from the bloodstream by removing bile acid, and they decrease your LDL and may slightly increase HDL. The main side effects that most people talk about is the bloating and gas associated with it. There's also constipation, nausea, and heartburn. We also have fibrates that you can also take. So that's your fenofibrate and your gemfibrozil. The way they work is they downregulate apoprotein C3 and upregulates the synthesis of apolipoprotein AI, fatty acid transport protein, and lipoprotein lipase, which breaks down the lipoproteins. They decrease your triglyceride levels and increase your HDL levels. Side effects associated with them is your nausea, stomach pain, and muscle pain. And then we have your niacin, which inhibits the key enzyme in the production of cholesterol. It decreases your LDL and triglycerides and increases HDL. The most common things that people will say they experience when they take niacin is the flushing of the face and neck, which can just redness of your face. It can also cause a little bit of itching, and it can also cause upset stomach and blood sugar increase. And then we have your omega-3 fatty acids. These can even be found over the counter, but some of the prescription ones are your Lovaza, your Amacor, and Vasipa. So they reduce the synthesis and secretion of that very low density lipoprotein and upregulates the lipoprotein lipase, which is the enzyme used to break down those triglycerides and lipoproteins. So they decrease triglycerides and may increase your HDL. Most people say that they experience the belching or the fishy taste. One thing to keep note of is that it can increase your bleed risk. So something to think about if you're on a blood thinner or if you're on NSAIDs about taking the omega-3 with it. And then we have our newer class of medications. There's only one in this. There's the citrate lyase inhibitors, which is your bempedoic acid or your Nexletol. They did have another one that was a Nexletol and Zetia combined. But the way this works, it upregulates your LDL receptors, which increases LDL uptake in the liver and reduces LDL concentration in the blood. So it just upregulates those receptors. It takes them out the bloodstream, so you don't have that buildup. And when added to their maximally tolerated statin, so you have to be on a statin when you're taking these, it can additionally decrease your LDL levels up to 18%. The one caveat to this is that it can cause hyperuricemia. So you have to have your uric acid levels checked. And this is something to kind of take into consideration if you are somebody that suffers from gout. There was also tendon rupture that was on there, but the most common side effects were these upper respiratory tract infections, muscle spasms, abdominal pain, and these elevated liver enzymes. And then I added this diagram just because it shows the different parts of where these medications work. So on the left, you'll have the pathway that cholesterol is made, and you can see the bempedoic acids. They work before statins work. Your statins are the ones that work on that rate limiting step that helps produce cholesterol. And then your other medications, so your Zetia is usually added onto that statin that works below the statins, and then your PCSK9 inhibitors are over there on the right. So most people, when they take statins, they complain of this muscle pain that's mostly associated in their legs. However, it can occur in other parts of the body. It occurs in about 10 to 15% of patients. It's thought to affect women more than men just because women tend to have more of this muscle pain. It can present as muscle cramps, soreness, fatigue, or weakness. And there's not really a clear idea of how this muscle pain is caused. One of the ways it's thought to be caused is by an irregular leak of calcium that comes out of your storage compartments within your muscle cells. And when this calcium is released, it causes your muscles to contract irregularly. And then another way it's thought to occur is by this coenzyme Q10 or ubiquinone. It's naturally produced antioxidant in your body. So whenever cholesterol is made, a byproduct is this coenzyme Q10. Whenever we're taking statins, since this pathway isn't being continued, this coenzyme Q10 is decreased. It's usually localized in your cell membranes. It protects against that oxidative stress. But then when those levels are decreased, it can impair your muscle energy metabolism. And that's another way that statin medications are thought to cause muscle pains. So as you can see in this diagram, you have your mevalonate pathway where cholesterol is made. And also that coenzyme is Q10 is made. But then when you have these statins, the pathway can't continue. So that coenzyme Q10 is just getting decreased in your body. So in randomized control trials that I looked up, I found some meta-analysis that compared some of these trials, and they looked at coenzyme Q10 supplementation at 50 milligrams per day when given with placebo in patients taking statins. The results show that the coenzyme Q10, it did ameliorate those statin-induced muscle pains, the muscle weakness, the muscle tiredness, and muscle cramps. There are still some studies out there that don't show these results, but then this meta-analysis, it did look at a bunch of different tests and trials that did show that it did work. Right. And these are my references, so I will be happy to take any questions.
Does anyone have any questions for her? Not all done.
Okay.